Hey, in this video, I'm going to give you my honest physical therapist review of the Orthomen osteoarthritis unloader brace. This is an unloader brace that's designed to take pressure off one side of your knee, either the inside or the outside of your knee, and you can adjust it so that it takes off pressure depending on how you adjust it. It's got some other cool features. I want to review this for you. I've had many requests on our channel to know about these braces, and so I got one for us to take a good look at. All right, I got my skeleton here so you can see what I'm talking about with the knee brace. When you unload the joint, they're talking about shifting the joint either this way or this way. So the brace can tilt this way or this way depending on how you set it up. I'm going to show you how to do that. So if you're a little bow-legged or knock-kneed, it can kind of push you in that direction. Or if you know that your arthritis is on a certain side of your joint, the theory here is that you can offload that side of your joint to take pressure off and help your arthritis. So it does this kind of unloading. A lot of people think that it's unloading like this way, like it's taking the pressure of the thigh bone directly off the shin bone, like it's pulling your joint apart like a traction, but that's not the case. It's tilting it either this way or this way. Let me just show you the features of the brace here. This is the right leg, so you have to buy a separate one for the left leg. They're not interchangeable, and they're labeled here thigh, so this part goes on your thigh and this part goes on your calf, and it's got this nice little rubber gel so that it grips your skin so it doesn't slide as much. There's a hinge right here so the knee can bend and straighten out, and you can't quite see it. I'll show you more in a second, but there's this little silver peg, I don't know what else to call it. It's like a piece that sits in there, and it's held in there by this screw, and there's another one on this side held in there by the screw that forces the brace to stop moving at a certain direction, and you have more pieces to put in there that adjust the movement of the brace. And then right here is the part of the brace that you would adjust to create the tilt that I'm talking about, and this pad right here goes on the outside part of your knee joint. Now the straps are a little different compared to your typical knee braces, so I'm gonna just clip this in so you see what it looks like all together before I put it on, and show you how to adjust it and wear it and use it if you're looking at using something like this. And then by the end of the video, I'll discuss a few points about when this might be good for you, if it's even an option for you, like if you should buy one or not, because this is not an entry-level brace. This is definitely a higher end brace. This is going to run you over $100, closer to $200, depending on where you get it from. So there's what it looks like. This is for the right knee, so your calf goes in here and your thigh goes up here. Thigh, calf, and it's got double straps, so there's numbers on here. See, 1, 2, 3, 4. So it's kind of self-explanatory. It's the order in which you put it on. I'll put it on in just a moment. Let me show you these adjustments. Oh, and it came in this box, kind of a just label-less box. I got it off Amazon. I've never seen these in stores. It was in this bag. You possibly have to get it off from a medical supply company in your area, or order it off Amazon. That's what I did. Pretty easy. So an extra strap. Here's the adjustment tool. Little screwdriver. It came with the screwdriver. That's really convenient. And then here are the parts that you use to limit. You can see there it says extension on this one right here and flexion. So that's knee straightening and knee bending, so that you can adjust how much your knee bends, which is a really cool feature of this. Now this hex wrench tool, you can see it's got a double-ended hex wrench. It fits right there, and I'm going to just show you what this does here. If I turn it clockwise, it starts to tilt the brace that way. You see how this top part went that way? And I'm going to turn it counterclockwise now, and it tilts the brace the other way. So that's how far it tilts. So it just has a little bit of movement in this direction, and you adjust it with this wrench right there. I'm just going to put it in neutral for now, so straight. Actually, let me just give you another view. So there's from the back, right there, you can see the brace is really straight right there. And then if I put this tool in there and turn it clockwise, it bends it that way. Counterclockwise, and it bends it the other way. It's pretty stiff. I mean, it's not too stiff for somebody to turn, but it looks like it'll stay, like it won't loosen. All right, so I'm gonna get this brace on me here. So here's what you would do the first time you're putting this brace on. Take off these Velcro straps so that you can adjust it to yourself. Just don't let the straps fall through the loops. There's plastic loops there. And just kind of loosen them up to right where the Velcro comes, where the Velcro starts on the straps. Make sure the thigh part is up so that you get your foot in there first. And then you have to have decided which side to use. So this is not an interchangeable brace like many are that you can get at the store where it doesn't matter which side, which leg you put it on, your right or your left. This one is built for the right side. So let me get it on my right leg. Put it in there. And the joint there needs to line up with your knee joint, so it's about right there. And remember, this is 1 right here, so I'm going to cinch that one down. It should be firm, but not so tight that it's cutting off your circulation. Here's 2. So you tighten that one next. Here's 3. Here's 4. All right, so now it's adjusted. It's firm, it's snug. And with these clips here, they have buttons. What these do is they allow you to quickly take the brace off and on. So now I can just hit this button and it pops off, and the Velcro's already adjusted, and I can just slide that off like so, and then clip it right back in without having to cinch down the Velcro. That's pretty cool. I'm just gonna go in the same order that the buckles were set up in. So there's 1, 2, here's 3. Oh, and these pivot. I didn't know that. Cool. And here's 4. Now, if I had a really bow leg, like my leg was going out or my knee was going in, I could make the adjustment right. Oh, where is it? Right there. And you can see the brace shifted. So it's kind of pushing my knee that way. It's pulling these braces, these straps, I'm sorry, or I can move it the other way and it's pushing my knee. It's pushing the brace into my knee a bit. All right, so there you go. Let me give you a different view of that. Oh, and I have a lock on this, so I can't really bend too much. All right, so here is, do it this way. Here's the adjustment for what we call valgus. So the knee, it's pushing my knee out, and then varus, it's pushing my knee in. So that's the unloading feature of this brace. Now I'm straight kneed, so I'm just going to leave it kind of in the middle, and there you go. It's actually pretty comfortable. I like that it's got a big gap here in the knee so that I can move, and I feel like I can, just put that over my shorts and I'll be good to go. Now, let me take this off so I can show you how to adjust the knee blocking. Oh, before I do that, see, I can't bend my knee more than that. My other knee bends great. I can bend it all the way, but this one's got a block in it, so I can't bend it much more. So I have to unscrew these screws here to take out the pegs. And let me just take this off so you can see what that looks like. All right, so let's take a look at how to do these adjustments here. So I'm just going to work on flexion first. These are all the flexion pieces. Came in this little zipper bag. I'm going to dump them all out. And you can see that these are just little wedge-shaped pieces of metal. They have a little button on there. That's to catch it so it doesn't fall in beyond a certain point. And it's got a little hole that the screw will go through so that it holds it in place. And you have these big, long, wide ones, and then you have some shorter ones. And since we're dealing with flexion, I would imagine the shorter ones allow you to bend more. So let me see what I put in here. Here's my screwdriver that this came with. Now this is flexion when it bends, so I'm going to take out this screw on this side of the brace. I'm just going to do this over the table so that it falls right on the table and I don't drop anything. Screw comes right out. No trouble whatsoever. Here comes a piece that fell out. There you go. So it's kind of a medium length one. I'm going to put the smallest one in. Oh, and it has numbers on there. I would imagine that has to do with the degrees. This one said, the one that was in there was 45 degrees. That feels about right. This tiny one is 90. And without one, yeah, you can see it bends all the way now. So I guess you could just take it out if you want to be able to bend all the way. But if you do want to block, there's a groove in there. That's where that little button will fit. So slide it in. Whew. Okay, now it looks like it's straight. I'm going to get my screw. Let's make sure it goes in the right spot. Here's my screwdriver. That's tight enough. All right, it doesn't fall out. And now I can bend to 90 degrees. Cool, that's about 90 degrees right there. Let's take a measurement, real measurement here. Let's go through the buttons. All right, about 90 degrees, close enough. That's actually on the dot, 90 degrees right there. That was a little 90-degree piece. I'm gonna put one more in. Let's put the one that blocks it the most, just to go to the two extremes. That was super easy to set up. It already fell out, so I'm not even gonna take the screw all the way out. That one says 10. That one says 0, so I'm gonna put 0. That means it's not gonna let me straighten out or bend my knee at all. All right, it's seated in. Let's screw that in. And at the end of the video, I'll tell you what all this means. Yeah, it's locked. It doesn't let me bend it at all. So it should be bending this way, like, should be bending like that. But that little piece blocked it. Okay, so then let's take that out. I'm gonna put all these away and let's do extension. Extension is gonna work the exact same way, but I just wanna show you real quick what it looks like, what those blocks look like. All right, we've got the extension pieces right here. Let's open up the little zipper bag. You have fewer of these. And these say 20 degrees. We have 40 degrees, 30 degrees, and 10 degrees. And there's one in there. So now my brace can bend 90 degrees. Now let's work on straightening. We should be able to straighten out 100%. That's what the knee brace is doing. All right, there it is. There's the part. Oh, there's some red stuff. It looks like maybe some lubricant that goes in there for the hinge. That's okay. All right, I'm gonna put the biggest one on here, which would be 40. Oh, and it's got a wider button on there, so you know that it's only gonna sit on that side. Let's get that screw in. All right, so now the knee brace cannot straighten out. It is locked. It can bend and straighten just this much. That is really, really cool. And it said it's 40, so let me just take a measurement here. On the thigh. That's as straight as it'll go. Let's get on the buttons. Looks closer to 35 or so. Maybe if I adjust, we'll see. That's okay. You'll be able to figure out what your limitations are based on what you need. So that's how you adjust the Orthomen OA unloader knee brace. And you would use it to block certain motions. And I think I'm going to go into my honest opinion about this. I think this is a cool brace. It's definitely worth it, especially if you have pain at the end ranges of motion and if you're dealing with arthritis or other knee conditions. I know they intend this for osteoarthritis. That's what OA stands for in the Orthomen OA unloader knee brace. But if you have trouble bending your knee all the way and it hurts at the end range, it's probably a good idea to not be repeatedly doing that unless that's your intent because you're trying to stretch that motion out or move into that motion somehow. Although I don't recommend repeatedly doing that and aggravating your knee joint. But that's where this would come in. If you are inadvertently bending or straightening your knee too much and causing more pain or discomfort, and you're dealing with an arthritis problem, then having something like this would be beneficial. This would also be beneficial for people with a meniscus problem, especially if you get locking in your knee joint from a meniscus problem, like a more severe meniscus problem would. This would prevent you from bending or straightening way too much. And so you could use this to prevent you from irritating your meniscus problem or the cartilage problem in your knee or the osteoarthritis problem so that it can calm down. Now, I wouldn't look for this to correct like a knock-kneed situation or a bow-legged situation. It just doesn't have enough bend and enough force. And the research behind this is there just isn't much to begin with. I didn't find much. So if you're out there and you found research articles about this, especially ones that aren't biased, like ones that weren't made by the same company, then drop them as a comment. I'd love to look at them and see what research comes out over the years on this type of unloader knee brace. This would be good to exercise with, especially if you're in a phase of knee arthritis where you're not super flared up, but you know that you'll make it worse if you bend your knees too much. That happens often. Then this one with a lock to bend, to allow you to not bend too far, would be a great idea so that you can more confidently go into exercise without worry that you're gonna overbend your knee and overdo it somehow, especially with an exercise like squats or anything that has weightlifting. Once you feel comfortable and your strength is coming in the right muscles, usually the glutes, then you probably don't need to worry about something like this because you're going to feel more confident. Your knee's just going to feel better. It's going to heal enough to tolerate the activities that you're putting it through. But this is a great option so that you can do everything that you can while you're flaring down from a knee arthritis flare-up so that you can get through that as fast as possible without making things tremendously worse. Hey, this is the first time you're finding me on this channel. My name is Dr. David Midoff and I'm a specialist physical therapist. On this channel, we focus on helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. And we make videos focused on giving people tips, advice, exercises, and stretches that are helpful to achieve that. So go check out our playlist. We have tons of playlists. We have some for knee arthritis, meniscus problems, and a variety of other knee conditions. Thanks so much for watching, and I hope to see you in the next video. Bye-bye.